today's meeting. Heads up to everyone that we are now going live on YouTube. Good afternoon and welcome. My name is Kristen Donhefner, and I'm the Measure 110 Strategy and Engagement Manager with OHA, and I'll be assisting with facilitating today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties email list by emailing oha.measure110@dhsoha.state.or.us. That email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting space introduce themselves in the chat. Please share your role with the agency, and if you are a subject matter expert, your area of expertise. I will now turn it over to Amy for welcoming remarks and the agenda.
Welcome, everybody. Happy Wednesday. Our agenda is going to be OHA updates, the grantee budget and service adjustment with BOA, Oregon, and Clackamas County. We're going to have our tri-chair election today, and we're going to be going into discussion in executive session as well. And I would like to turn it over to Sydney for attendance.
Thanks, Amy. It's good to see everybody. If you could please say here when I say your name. Amy?
Here.
Hi, Amy. Carlos? Carlos said he would be a few minutes late, so I'll watch for him. Caroline?
Here.
Hi, Caroline. Dharma? Hubert?
Here.
Hi, Hubert. Hunter?
Here.
Hi, Hunter. Jackie. Jackie will be here shortly, I believe. Jonathan? Keisha. Leticia.
Here.
Hey, Leticia. Linda. Melinda.
Here.
Hey, Melinda.
Hey.
Meredith.
Here.
Hi, Meredith. Morgan.
Here.
Hey, Morgan. Nicole.
I'm here.
Hi, Nicole. Onisha.
I'm here. Hey, everybody.
Oh, there you are. Hey, Onisha. Let's see. Ron let us know he would not be here today. Ryan.
Here.
Hi, Ryan. Sabrina.
I'm here. Sorry,
Oh.
It took me a while to get to my mute button.
That's okay. Hello, Sabrina. Zeb.
I'm here.
Hey, Zeb. And then Sam, I don't think is going to make it today. And Annalise.
Here.
Annalise. And see Dharma's here in the chat. Just want to go back through here real quick. Carlos. Jackie. Jonathan. Keisha. Linda. All right, we're good to go with 16. Excuse me.
Thank you. All right. Thank you for that, Sydney. Thank you, everyone, for being in attendance today. I would like to read a statement. The tri-chairs, on behalf of OAC, received a comment letter from Clackamas County regarding the 2025 to 2029 funding formula. We know not everyone agrees with the funding, with the formula the OAC agreed to, but we will not be making changes to the funding formula, as doing so would delay the next round of grant funding. Also, we are in the process of accepting applications for grant funding, and we do not think it is appropriate for the OAC to consider a change to funding in the middle of this process. We ask that any future comments or questions about the RFGA be directed to the single point of contact. Thank you for your letter and your concerns. I would like to now pass it back to Kristen for OHA updates.
Thank you, Amy. We just have a couple of OHA updates. And the first one is a reminder about the request for grant applications. That is now open and available on Oregon Buys. It opened on Friday, August 2nd. And the deadline for applications is October 4th. While the RFGA is open and people are able to apply, all questions about the RFGA need to get routed to our single point of contact. And that information is in the application available again on Oregon Buys. The OAC and OHA, otherwise myself or Sydney or anyone else, are not allowed to answer questions about the RFGA while it is open. And that's just to make sure that we're getting consistent information out to people. So we're really taking that seriously this time around, and just want to direct anyone here who gets a question to forward those to single point of contact. And maybe Sydney, you can put Chris's information in the chat as well, just so people have it. Also related to the RFGA, I wanted to share that we will be publishing an adjustment to the county by county allocation. It was brought to our attention that when we calculated the numbers, we accidentally used the total overdose deaths instead of the average overdose deaths in that formula. So the council had approved us to use averages, and we accidentally used totals. So those numbers will be posted in Oregon Buys as well. The changes were pretty minimal, barely less than 1% in some instances. I think less than 10% in other at the kind of far end. So just wanted to apologize for that mistake. Again, we didn't change the formula, just changed the numbers that we had plugged into it. We also want to remind everyone here that we are still hopefully having a training next Wednesday. And if that still is on, we're still finalizing details. More information will be sent out either later today or tomorrow. And we also have an update on equipment. We are going to just be requesting that all equipment be sent back to OHA so that we can inventory everything and kind of restart, revisit how we want to do laptops and phones if we want to do that. So you'll also be receiving more information on that, along with how to turn in any phones or laptops that you have. And that will come to your email from Sydney later this week. And I think those are our big yays, I hope, from folks. I know it's been a pain. So our next agenda item is a presentation. Today we are going to be joined by representatives from the Volunteers of America in Clackamas County. They are here because they are requesting two things. They're requesting to add a service area to their grant agreement, which has not been done before. So that's a new ask from a grantee, but that is something that the council can approve. They're also asking if that is approved for a budget adjustment that is more than 25% of their overall budget. So that is what they are going to be asking you. I think we have Nikki and Christina in the waiting room, so we can let them in.
Sorry, I'm screen juggling a little bit. I'm going to go ahead and put the conflict of interest slide up while we let them in. Is that okay?
Yeah, that's great.
Email Forgive me, it's another presentation, but
No, it's all good. So while they're joining, we just want to make sure we call for any conflicts of interest with Volunteers of America in Clackamas County. As a reminder, OAC members with an actual conflict of interest cannot participate in the discussions today. If you announce a potential conflict of interest, you must announce the nature of the conflict, but you can participate in the discussion and vote. And if you announce an actual conflict of interest, you must announce the nature of the conflict and refrain from participating in the discussion. So with that, I will pause and see if anyone has a potential or actual conflict of interest with Volunteers of America, Oregon in Clackamas County. Okay, and I don't see any hands. Thank you. So I'd like to welcome Christina and Nikki from Volunteers of America, Oregon, who are here today to present their request. Sydney will share their slides, but just like to thank them for being here, and I will turn it over to Christina and Nikki.
Wonderful. Thank you all so much. We really appreciate you all taking the time to have us on your agenda today. Thank you all for everything that you're doing for Measure 110 across the state. My name is Nikki Dardinger. I use they, them pronouns. I'm the grants director at Volunteers of America, Oregon. And I'm here with my colleagues, Christina, and it looks like Rhonda is with her as well. Christina and Rhonda, do y'all want to introduce yourselves?
Yes, thank you so much for allowing us the time to come in today. My name is Christina Anderson. I am one of the program directors operating over Washington or outpatient in Multnomah County, and the burn program for Multnomah County and Clackamas County fall under my portfolio.
Hi, I'm Rhonda Van Zandt. I am the burn program manager for Multnomah County and Clackamas County.
Great. Thank you both so much. So we can go ahead and advance to our next slide. So we are here today with two requests for the OAC. So the first is that we would like to add peer support, mentoring and recovery services as an approved service in our Clackamas County grant agreement. So that is our first request, and we'll talk a little bit more about that. Our second request is that we would like to amend our Clackamas County budget to align with this request. So it does represent more than 25% of funds being shifted. And it is primarily so that we will be increasing the number of peers that we have in Clackamas County, as well as adding some support to be providing needs assessments and substance use disorder treatment. So that's what we're here today to do. You can go ahead and advance to our next slide. So just for some background, we are currently approved in Clackamas County to provide screening assessments, behavioral health needs assessments, and substance use disorder treatment. However, we are not currently approved to provide peer-delivered services. So next slide, please. Just for some background on how we got here. So when Volunteers of America, Oregon first put together our proposal for Clackamas County, our plan at the time was simply to provide substance use disorder treatment and to have a funding available for clients who were uninsured or underinsured and needed access to treatment. And that's what our proposal was built around. It had very limited staff, and again, was just really designed just to be able to have funding available to clients who need it. When these awards were made, as you all remember, there was some additional money available in Clackamas County. And when Volunteers of America kind of discussed amongst ourselves, hey, what might we do with this money? What are the needs in the community? We said, hey, it would be really great to have a peer mentor to support this work that we're doing in Clackamas County. So that peer mentor was approved in our budget. However, what we did not do at the time, and just internally, we didn't even really realize this, but we didn't also adjust our agreement to include peer mentoring as part of our scope. So we've had a peer, but we haven't been able to provide peer services as outlined in our agreement. So as we get to now, kind of fast forward to today, as we've just been kind of figuring out how things work in Clackamas County, we are seeing clients that are needing to access this this bucket of funds, clients who are uninsured or underinsured. So we are seeing that, but it is not nearly the level that we kind of originally projected might be needed in Clackamas County. And so we've really talked as a team to say, well, what would be better? Like, what are the needs in Clackamas County? Talking to our partners, talking to our staff. And so what we've really seen is that there's a need for some peer support for folks who are accessing treatment in Clackamas County. We also have just known internally that we see kind of a need for some additional support for assessments, which just helps with like that timely access to treatment and being able to get the care that folks need. So next slide, please. Perfect. So as you can see, this is a really small number of people that have been served, and that is because the people that we're counting are only the clients who are uninsured or underinsured and need support with accessing treatment. So those are the numbers that we're counting right now. We could be serving a lot more people and be providing better care if we also had peers who are supporting these clients, helping to get clients into treatment, and then also supporting those clients once they are there. So next slide, please. I do want to just highlight some successes. So prior to kind of this project that we've been working on, Volunteers for Miracle Oregon didn't have a really significant presence in Clackamas County. So we knew that with this project, we would need to take some time, build relationships with our partners, both our burn partners, our community partners. We were there, but not nearly to the extent that we were in Multnomah. So our team has done a great job building relationships with everyone who's operating in Clackamas County. And then again, we are providing substance use treatment to Clackamas County clients who are uninsured or underinsured. But we have had some challenges. It took some time for our team to get established, kind of build these partnerships. And as I've mentioned, we're seeing just a small number of people who need, who don't have the insurance they need necessarily, right? Many clients have OHP or other insurance. So there just aren't that many people who just need treatment, who don't have the insurance they need. But our other challenge is that our Clackamas County peer mentor has just been limited in what they're able to do, since peer services are not one of the approved services in our agreement. Next slide, please. So just to kind of talk through the budget adjustment and what this looks like, we're requesting this adjustment between categories. It is largely moving money from services and supplies, which is where we had that bucket of money for clients who are uninsured or underinsured, and it is shifting that to personnel for the most part, so that we can have some additional support for peers. And we do want to be clear, because this was something that was asked to us as we were kind of putting these slides together, that we are absolutely going to continue to provide substance use disorder treatment. We will still have funding available for clients who are uninsured or underinsured. So it's not going away. It's just that we don't need as much of it. So we will absolutely continue to provide treatment to all clients from Clackamas County, regardless of their ability to pay. We just believe that this adjustment is just going to better meet the needs of the people that we are seeing. So next slide, please. So some details about what this looks like. You can see in our current approved budget for personnel is $209,000. Our proposed budget is we're requesting an increase to $377,000 and change. So what that supports is the addition of 2 additional full-time mentors that will bring our team from 1 full-time peer mentor to 3. We're also asking for funding that would increase the time that our burn manager, Rhonda, who's here today, would be spending in Clackamas County. We just see it as a need. She's been very focused in Multnomah. Our project there is going really well. And so we just see a need for her to shift some of her time over to Clackamas County. This shift in funding would support part of the time of our assessment team supervisor to help with assessments. And then it also increases a little bit of support for our outpatient treatment team, who is supporting the teams that is delivering the substance use treatment. So we really see, we've talked this through, and we really believe that this switch from service and supplies to personnel, it's going to increase the number of clients that we are able to serve. It's going to increase the care that they receive, because they'll be more able to access peers. So next slide, please. So our training budget is just being adjusted very slightly, and it's just in alignment with our expected staff training expenses during the rest of the project. And then the services and supplies, this is really, again, reducing this because there have been less uninsured and underinsured clients who are receiving treatment than originally budgeted for. Next slide. We could go, yeah, thank you so much. We had already made an adjustment earlier with OHA and capital outlay. We had originally budgeted some computers and computer-related supplies as capital, which really belongs in services and supplies. So we had made that small switch earlier, and we're not requesting any changes to our administrative cost that had already been approved. So next slide, please. Wonderful. So we did, we got a question, hey, what happens if these requests are not approved? And we want to be like really real that we would likely not be able to spend the funds as originally outlined. It's just not where the need is in the community right now. So we just don't believe we'd be able to spend it as currently outlined, and nor would we be able to serve all of the clients who we think could access services with us. But we do believe that if the changes are approved, we feel confident that we will be able to spend our remaining grant funds while also doing a better job of meeting the current needs of clients from Clackamas County. So with that, next slide, please. Thank you all so much. I don't know if Christina and Rhonda have anything else that y'all would want to chime in before we take some questions, but I do just want to give y'all a minute if you do.
I think it's really important to also note that when we first wrote our proposal without writing peer services in there, many of us know that the community at large that we're operating in out there is best served in teams. So at this moment, we have one peer mentor for Clackamas County, and our office is centrally located right next to the Springwater corridor that runs to Clackamas County, which has been very helpful in allowing our mentor to be out there in the community doing outreach and providing services that would help either move a person toward wherever they're centrally located, right? Either closer in or closer to within Clackamas County city limits. But providing those services, again, we don't have peer services really within our grant, and not being provided in teams of two. Our agency has found that that's just how we would really like to move towards for safety and community reasons. But more importantly is we'd like to get farther into Clackamas County and help other agencies within Clackamas County help individuals get to those services wherever it is that they're wishing to be referred. I guess that's really what I'd like to say about it. Are there questions?
Thanks, Christina. And thank you, Nikki. I see Melinda, you have your hand up.
Yes, I have a question. I just wanted to know who's supervising your peers. Who's doing the supervision?
Yep, Rhonda, who is here today, she supervises our peers.
Okay.
Rhonda holds a CRM 2 along with a CADC 2. She meets all the qualifications with lived experience and clinical experience, as well as myself.
So you two are supervising the two peers that you're gonna.
No, Rhonda.
Okay.
I'm supervising the peers and training them and directing them where.
Okay. And what's your role now?
So I'm the program manager.
Okay.
Yeah.
Thank you.
Mm-hmm.
Thanks, Melinda. Zeb, I see your hand.
Hi, thank you. Could you guys describe your relationships with your burn partners that do provide peer support as it exists right now?
Okay, we're off. Okay, so right now I'm attending the Clackamas County burn meetings and also building relationships with Park Creek and the CCC lead program. We've had a good relationship with getting some clients with them that needed services and transporting them and connecting them with the mentors and getting them in intakes.
Are we speaking just Clackamas County? I think it's also important to note that as both counties and all of the counties are starting to move towards this deflection, which I know that Clackamas County is in the process of appealing so that they can get their deflection dollars to get set up. I think it's really important. How do we reach those individuals that are being moved towards, moving away from substance abuse treatment or any services, housing, any services that they need, as things are going to start to change September 1st in all of the counties. And I think it's really important that Clackamas County, if they don't get any financial funding for their deflection program, that we have peers at large in the community to help individuals be served.
Zeb, did that answer your question?
I mean, kind of. You said building relationships, so is it relatively a new thing, the relationship building parts? I'm kind of just wondering, like, the existing structure that exists within the burn as a whole right now.
So it's been a challenge with the Clackamas County because we don't have the peer mentor. So it's like being able to navigate clients between the different programs and stuff. So it's like, we'll be going to like the harm reduction center and connecting with different people. I've gone into the burn with CCC in Clackamas County to be able to try to connect with some of their staff to coordinate peer services, but with the existing contract, we're only able if they were only in treatment, right? So we had to, it's doing that peer service to get them connected and walk beside them that we were having problems with. And so really finding those connections and getting our peers out there to get into the camps or the deflection center, hopefully whenever you guys get that facilities, and getting different contacts made so that we can navigate these clients that need services.
Okay, thank you. And then another thing, so would this be adding another peer position or taking the existing peer position and just giving it more freedom to operate as you guys?
It's adding in an additional peer and actually providing more freedom, as we're not, our contract doesn't allow for peer services. So we can go do screenings. We can't provide the peer services.
And do you guys believe that the additional peer, along with the peer that you guys have, will help you guys' relationship with other burn partners working together?
I do.
Okay, thank you.
Thanks, Zeb. Amy, your hand's up.
Just to clarify, you were only adding one peer or two new peers?
Two. We're adding two. So it would take our team,
Okay.
which is currently one, up to three. So we're adding two peers. Yes.
Okay.
Just to be clear.
Okay. Thank you for that clarification.
You're welcome.
I knew it was more than one. I was like, wait a minute.
No worries. No worries.
Right now we have one.
Irma, I think you're next.
Yeah, and I'm sorry if I missed this. I was having some connectivity issues for a second there, but I was wondering about supervision for the peers that you're adding on, and if what that might look like for your peers now, and how you see that with the added peers, how supervision might look for all those folks.
So it'll be actually a group supervision and being able to network within inside our group and be able to start connecting the different resources that they can have, seeing what their needs are, training during supervision, different support.
I think it's also important to note that Rhonda holds a CRM2 and she's also a CADC2, and she will only be supervising a total of 5 peers. So group soup and individual soup is very reachable and reasonable.
Okay, so you said that she was a CADC2 and a CRM2. Then that's the supervisor. Okay, perfect. Thank you so much.
With her own lived experience, yes, she's a CRM.
Sure.
Yeah.
Thank you so much.
Thanks, Dharma. Are there any other questions for, yeah, Caroline, I see your hand is up.
It's not a question, it's just a comment. Thank you for the presentation. I think it's I think it's important. I'm not really sure how the other I guess approved contracts that we have made are really monitoring, you know, their budget and their needs. And so I applaud you guys for identifying that and realizing that you probably had too much in other areas, because when everyone started submitting their applications, I mean, this is all brand new. If we could see the future, we would have probably anticipated a little bit different. But I applaud you for identifying it when you still have time to adjust your budget and to add the needed services, and realize that you might have overdone the supplies, and that you could adjust all that. Because I truly believe, in terms of what we're seeing, is the fact that peer helpers have actually, they're kind of like that in-between level where people are still willing to approach them. So I just making a comment, it's not a question. So I thank you for your presentation.
Thank you.
Thank you.
Thank you so much.
Thanks, Caroline. Any other questions? Not seeing any. Christina and Nikki, thank you for being here. We're going to put you in the waiting room so we can call you back if there are questions that come up, but we'll just put you there for the discussion and the vote. But we really appreciate you being here today and sharing more about your organization and making this request. Thank you.
Thank you so much.
Thank you all so much.
Okay, opening it up for discussion. I'll be quiet. This is your time.
Well, I'm ready to make a motion to approve the changes in terms of making an adjustment with their budget to include the peer mentors, and to take it away. Oh, good. Thank goodness. Motion to approve the budget adjustment in addition of peer services as proposed in the slides for Volunteers of America, Oregon in Clackamas County.
I second. Oh.
There's a motion from Caroline and a lot of seconds. Just want to make sure that there's no other discussion or questions or comments. All right, Hunter.
I like that they have peer-led peer supervision. And kind of on Carolyn's point, I like that they identified the need. And to Zeb's point, I think that those relationships with burn partners, now that they have a peer program, those peers can be out in the community working with individuals that they're going to be serving, will definitely help to strengthen those partnerships with that burn that may not have been there before. I think that they said they were like in that before. I don't think that 5 peers is too much for the one peer supervisor for group or individual supervision, and I think it's a good idea.
Thanks, Hunter. All right, I think I'll turn over to Sydney then for a vote.
Sure. So I dropped the motion in the chat just in case anyone needs a refresher, but that was seconded. Amy, how would you like to vote?
Yes.
Thank you. Carlos?
Yes.
Caroline?
Yes.
Dharma?
Yes.
Hubert?
Yes.
Hunter?
Yes.
Jackie?
Yes.
Jonathan?
Yes.
Did Keisha join?
Yeah.
Yep, Keisha. Keisha, is that your vote also? Sorry, I think you cut out for a second. Was that a yes vote, Keisha?
Yeah.
Okay,
Yeah.
thank you. Thank you. Leticia?
Yes.
Linda,
Yes.
Melinda,
Yes.
Meredith,
Yes.
Morgan,
Yes.
Nicole.
Yes.
I see Onisha voted yes in the chat. Ryan,
Yes.
Sabrina,
Yes.
and Zeb.
Yes.
All right, that passes unanimously with 19 yes votes.
Thank you, everyone. Appreciate all of you taking the time to hear that presentation and vote. Our next agenda item is tri-chair elections. Amy's term as tri-chair is coming to an end. So we are hoping to have a vote today on electing a new tri-chair. I think with that, I'll pause and see if there are any self-nominations for tri-chair. Amy, I see your hand is up.
I just want to put myself out there to continue as your tri-chair representative. And I really enjoy being able to bring the rural Oregon to it. And, you know, being out here in Eastern Oregon, that helps a lot. So, and I have been committed to this from the very start, as well as many of us, and would just like to offer to continue.
Thank you, Amy and Onisha.
Yeah, I want to self-nominate myself for tri-chair. I have been committed since the very beginning. It has been a few years now. I'm not going to stop, whether I'm Measure 110 council or not. Advocating for those who've been most impacted by the war on drugs, advocating for the rural areas, advocating for culturally specific services, advocating for fair pay for the OAC Council, reminding them of things we need and being that voice when needed, being willing to speak in the public, being on time with my DocuSign, reading through all the documents that are sent to me so that I fully understand them, and being able to come to the table with everybody's consideration from the community, from the consumers, and the peer professionals who are doing this work.
So, Onisha. Is there anyone else interested in self-nominating for tri-chair? Okay, I don't see any hands. So Sydney, I think I might pass it over to you for a vote. Generally with these, we just say, state the name of who you'd like to vote for, and we'll go from there.
Okay, so if you would like to vote for Amy or Onisha, you can just say their name and I will keep up with that. Amy, who would you like to vote for?
Amy.
Got it. Carlos?
So my choices are Amy or Onisha.
Onisha, that's correct.
Damn, I hate picking between people. I really think that Eastern Oregon really needs representation. I really believe in Onisha's work, but I also think that Eastern Oregon really needs a lot of support. So I'm going to go with Amy. And I hate picking between people.
I know you do, Carlos. Thanks for voting. Caroline?
Carlos took those words out of my mouth. I think Onisha's done an excellent job in the past, but I too think that we need to represent the rural area in the eastern part. So I have to go with Amy.
Thanks,
Sorry,
Caroline.
Onisha.
Dharma?
I just think that you're both great. I just want to say that. I think that Onisha has just brought so much focus on those most impacted by the war on drugs and the spirit of Measure 110. I think you'd both be excellent, but I do choose Onisha.
Thanks, Dharma. Hubert,
Onisha.
you Hunter,
It sucks to have to choose between the two. Because of the rural piece, I'll go with Amy, but for that reason alone.
thanks, Hunter. Jackie,
I was just thinking that my vote is to add an extra position to council. So thank you all. No, okay, so I have to choose. So I don't wanna, but I'll go with Amy. Next time we'll get Anisha back. I'm sorry, you're not allowed to say that.
thanks, Jackie. No, I know it's a hard decision. Thank you all for voting. I know it's hard. Jonathan,
You remind me who else is on the treasurers?
we have Dharma and Melinda
Melinda.
currently.
Onisha.
Thank you. Keisha, Keisha, you there?
Oh, can
Oh,
you
there
hear
you
me
are.
now?
Yep, I hear you.
Yeah. I'm gonna have to go with Onisha. It's one thing to represent, but it's another thing to understand policies and what's going on and be able to advocate that clearly. So I'm going with Onisha.
Thanks, Keisha. Leticia,
This is a really difficult vote. I'm gonna vote for Onisha.
you. Linda,
I echo everyone that this is really difficult and both would be amazing, but I'll vote Onisha.
thank you. Melinda,
Hi, everyone. I'm piggybacking off of what everybody been saying. We do need representation in Eastern Oregon. However, the BIPOC population is the war on drugs is what most more concerns me. So I'm gonna go with Onisha.
thank you. Meredith,
Amy.
thank you. Morgan,
This is a terrible vote. Let me go with Onisha.
thank you. Nicole,
Amy.
thank you. Onisha,
Onisha.
I had a feeling, but I figured I'd ask just in case. Ron is not here. Ryan, oh, sorry, I didn't hear you, Ryan.
Onisha.
Onisha, gotcha. Thank you. And Sabrina
Amy.
and Zeb.
I'm sorry, I'm on vacation, so I can't vote.
Nice try, Zeb. Everybody else voted. You have to too.
Both are absolute superstars, and we're lucky to have them both. This time I'm gonna vote for Onisha.
Thanks, Zeb. So do I just say like, is there any ceremony circumstance? Do we need a drum roll? Like
I haven't been paying. I've been letting you take out.
no worries. Hey, so we had 11 votes. The winner, of course, you're all winners, but Onisha has been selected. So congratulations, Onisha. We're looking forward to having you back on the tri-chairs and working with you as usual. And we'll get you the invite sent out so you can shadow again and get used to the meeting cadence and everything. And Amy, you will serve your seat until September the 13th. So still got some time. And of course, don't let this keep you from being involved still. Same thing I told Onisha, like
No, I'm
So,
stoked.
yeah.
I love
Yeah.
everything Onisha does. Her energy, her passion, her knowledge base, everything. And I just, just expand that out here to Eastern Oregon, girl. And there's nothing that's going to stop you ever. We really need it out here. And I love everything you do. So I already knew this was the way this was going, because like you're a rock star. And I've watched you grow.
I love you too, Amy. And I'm willing to learn from you, and anything I need to know, I definitely will take in everything you're passionate about and everything you're experiencing out there, and it matters to me.
You're amazing. Thank you. Congratulations.
Yeah, congratulations.
Thank you, everybody.
Thank you all for that hard vote. I think we've gotten used to having 2 seats previously, so there was a little bit of a, it was like, it's not as finite with 2 seats, and the one was hard. So I just want to acknowledge that. Thank you all for doing that.
So thank you everybody for your votes and everything. At this point, this ends our public portion of the meeting. And the Oversight and Accountability Council will now meet in executive session pursuant to ORS 192.660 and H to consider attorney-client privilege advice. If anybody had any questions, one of those quotations. So, representatives of the news media and designated staff shall be allowed to attend an executive session. Representatives of the news media are specifically directed not to report on or otherwise disclose anything said about these subjects during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session, and we will not return